Hi YouTube, this is Amy. I'm back. Um, I've been trying to put videos on my YouTube and my computer shut down. Like, I think it's just the battery. It completely died. I haven't really been around to take care of that or replace it or whatnot. I have a tablet which is not loading my videos. I don't know why. So then I have my phone, and now I have this, my old camera here. I'm gonna go and get on my husband's computer and hopefully get this loaded up. I'm gonna try to get all my other ones loaded up too, see if I can fix all that, send it to his computer and do that. There's a lot you guys have been missing out on. I've lost all the weight that I need to lose, and I had 3 days ago my tummy tuck, my skin removal surgery, for just the tummy. I'm going to get the thighs done, but just not yet. I got to get insurance to cover that. They deny me this time, but that does not mean that, it's just going to be denied. Anyway, so let me kind of go ahead and show you what has happened. All the YouTube videos that I've watched for myself to try to prepare myself for this, skin removal surgery, honestly literally scared the living daylights out of me. It's not that bad. All these videos I've seen, and I'm not, dissing anybody as far as, oh, you're wusses or whatever, because everybody is different. But I haven't seen very many videos where they have really good experiences. And I would say mine is one of them. I don't know if it's my attitude, my personality, or just the way I'm a very positive thinker, for the majority of the time. I mean, of course I have my down moments. I'm not always, happy-go-lucky, but for the most part I am. So I'm going to show you what happened and what I did, and I'm pretty happy with the results. This was just 3 days ago, and I got home, today is Sunday, I got home Friday night. All the kids went to our best friend's house, and they watched all 4 of the kids for us, which is awesome. And my husband's actually gone now to go get them, so now they're coming home to mom, and there's gonna be a lot of changes, a lot of precautions. I got a 3 and a 4-year-old. They like to jump on mommy, so we have to watch out for that. I'm probably going to stay in my bedroom most of the time because my bed is high up off the ground, so there's less of that chance of them jumping on me. I'm already walking straight. I do not have to be bent over. I was at first, because of course it's weird, with it tightening around this area. She has it really low. Like, she did an amazing job, and I will show you. I'm not shy. I do have before pictures of the excess skin, which I'll try to see if I can edit that in there. I don't know if I can or not. I'm just going to try to get this up, hopefully. So anyway, let me go ahead and show you what they've done. And I have a shirt underneath my binder, which you have to wear for like 6 weeks or whatever. And I do have painkillers. I have really good painkillers, but I have gone without them, for 12 hours, 10 or 12 hours, I think it was. And yes, it hurts, but it's really, really not that painful. And I don't know if it's because, like, when I seen I had to see the physical therapist before I left the hospital. They wanted to make sure they can go up and down stairs, and they wanted to see how straight I could stand. And I'm standing, pretty straight. And so this is it. This is my drains. They're down really low, like right there by my junk. And let me show you. So I should get these out in a couple days. I'm going to go see my surgeon, and I think they're going to take these drains out. I did have a pain pump. They call it a pain buster. And stick that back there. And it was from here to here. They had 2 incisions where the pain buster was all, you know, inside the abdominal muscle area, because she did sew my muscles. So, and yeah, it's a little bloody, you know, not bad though. You know, and this is 3 days after. Everything's really weird, and it's not proportioned properly. Like, it's swollen, not everywhere. It's only swollen in certain areas. Make sure my underwear's up. Okay. So here it is. I have pads on, by the way. I decided to do the pad thing because it's cheaper than all the gauze, and you know, it's panty liners. I mean, they're perfect for this. That wasn't even on all the way, but anyway, so this is it. Trying to keep things covered that need to be covered, but it's from, and again, I'm swollen quite a bit, especially in this area. It's really, really tight. It's like a rock. It's really, really tight, but it's like swollen in different areas. It looks kind of blotchy. And there's my belly button. It looks a little high to me, but maybe after everything settles down, it does its thing. Again, this will all go down. My legs are really swollen too. But so there's this. I'm trying to look in the mirror here. And then, yeah, the drains are down here. She got this pretty low. I mean, itches too. It does itch really bad. Benadryl can help that. But, oh, I got an incision up here because she was trying to pull the stuff from my back area to kind of help that. Now, my next surgery is going to help the back part. So here's the side. And again, you know, I'm still swollen quite a bit, especially on this side. This side's more swollen than the other. But she's going to help all this right here. I don't like that, of course. So all that is going to go along with my thighs for the next surgery. And that could be within like 6 months to a year. I'll have that done. I'm just going to heal from this, be happy about it. But yeah, I can stand up straight just fine. It does pull. But the physical therapist told me that hunched over like this, although that's kind of what you're going to feel like you need to do, and your surgeon's going to tell you to do that you have to be hunched over. But the way she explained to me that that's how your scar tissue is going to land if you are just always like this. You want your scar tissue to heal properly, and I mean, I guess it's common sense. You stand up straight and that's how you're going to heal. So I'm fine. I haven't ripped anything. There's a little rip that's right here, but I went ahead and I just taped it, you know. But yeah, I did it. I mean, this is it. And again, I cannot wait to get rid of this stuff. And I can't wait till my belly button kind of like looks normal. But the most tender areas are right here, on the sides right here, and my belly button area. So I need to get my bandages and stuff back on. I can bend over and all that good stuff. It's not a big deal. I don't have any problems with it. Just don't lift. I haven't lifted anything. Well, kind of did, but I felt fine. But I am making sure that I go by the doctor's rules. And I'm not going to lift anything heavy. Anything more than a gallon of milk, I think is what she said. But anyhow, the drains are kind of a little bit of a pain in the butt. I'm trying not to flash you here, but yeah, everything's changed, including, you know, my vagina and everything. It looks different too. She tightened up that little pooch that, you know, after you lose all that weight, you even have a pooch like right there above, just right above, you know what I'm talking about. So that's, you know, it's sewn pretty tight. And I'm happy. I'm happy with it. I've never, ever, 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 ever had a flat stomach like this. And it's gonna get flatter. So anyway, sorry, they tell you to put a shirt underneath your yeah, this thing. Which I can't seem to talk right now. I'm high as a kite on painkillers, but put a shirt underneath because it helps, because it kind of itches having this around you. But I'll tell you, it feels so good to have this on. It does kind of bother me sometimes. I have to kind of take it off for a minute and then put it back on. Once I put it back on, it feels really good. You feel supported. So, and I actually also got a black one too. I've got it doesn't Velcro though. It's like a corset. So it goes just like this, but it has all the little latches on it. But it's plain and it works. And this is kind of how everything goes. Is how I got a dress. I couldn't fit in any of my other pants. These are like the only ones, thank God, because my legs are so swollen and tight. I went to put on some slacks. I was like, well, these slacks were big on me whenever I had the excess skin, so it'll be fine. And it's really loose, but they won't go up on my legs because they're so bad. Another thing too that I noticed, which I don't know, I mean, if everything settles, how it's gonna look, but my legs in the front used to have like cottage cheese look. Just like ripply, and it's not. It's completely smooth now. I don't know if it's by her pulling, this stuff together, and if it's gonna stay that way, but I can't complain. I mean, she took off about almost 5 pounds of skin. I got to see it when I woke up. First thing out of my mouth was, "Where is it? I want to see it." And I'm like, "What?" I'm like, "Where's my skin? I want to see it." So I'm looking around the room, and she's like, "Oh," they started laughing. And like, "Yeah, you can see it." So they bring it up, and it's like in a container, like a square, clear container. And I saw everything they took off. I could not leave that room without seeing that. One thing I didn't ask her if she did the liposuction, like on the sides right here and here. I know she stitched my muscles together. But she did a great job. She did a fantastic job. I'm very, very happy with the results, and she's going to be the one who I pick to do my thighs. And I may or may not get my arms done and my boobs, don't know. I'm happy with this area up here. I'm alright. I don't care about the arms and all that. Yeah, because I mean, they're not that bad. But yeah, so I still look really funky and swollen and not a big, huge difference it looks right now, except for when you take it off and you notice, hey, there's not a whole bunch of excess skin. But I got it done. So I'm pretty happy. I really am. 2 years, from getting gastric bypass to, well, it's been about 20 months, so close enough. But anyway, oh, this right here was for my pain pump when I had that, and I kept the bag to keep these old doodads, and it works better. I did the whole pinning it on, and it's kind of a pain in the ass. Then, also I've seen people with those like tag holders or whatnot at a Guinness one, and I was going to do that, but hanging them on over my neck just didn't feel, but even this right here, right over here, it's not very comfortable. But this works perfectly fine. Doing your drains, it's pretty simple, it's pretty easy. Taking care of everything, it's pretty easy. I got the stepping stool for my bag because it's really high, but I found out I didn't really even need it. I can move around just fine. Like, for example, let me show you. This actually gets in the way. I'm going to move that. But I can easily get up in my bed. No problem. I got my pillow where I put my legs up on. I've got everything here, all my equipment. My sheet for my drains. I've got reading material. This is where all my other equipment is, my medicine. Then here I've got, like the pads, the blue pads they put on the bed so you don't, any of your stuff leaks on the bed, I actually have a hospital blanket that I have underneath this that I lay on, along with one of those, so I don't get my new mattress all messed up. Then I have snacks in here. I got graham crackers and, like 100-calorie little chips and stuff. And so I've got that. The water, everything. But yes, I can move around. I can bend over. I can turn this way. I mean, it's not really that restricting. So I just kind of wanted to do a really good video that hopefully won't scare people about the aftermath of having surgery. I think if you prepare yourself well enough, mentally and physically, I think you'll do just fine. Of course, it depends on your surgeon and how the surgery goes. I'm sure for an older adult, it could be a little different, because the younger you are with surgery, the better you heal. Make sure you eat a lot of protein. I do the juicing thing now, so I know I'm getting a lot of vitamins and mineral, or just all the good stuff, nutrients and everything else. So I hope this was informative for you, and hope I didn't talk too much. If you have any questions, let me know. I'll try to keep up with my YouTube. It's really, really hard right now. Maybe while I'm laid up in bed, I can do it, but I'm a pretty active, busy person, and I just don't ever stop. So, again, I hope this was informative for you. And good luck with anybody who decides to do this. It's worth it. It's well worth it. I don't care about scars. Personally, I just don't. They're going to be tattooed over anyway. So, which I'm not looking forward to tattooing over scar tissue. I don't know how that's going to be, but especially all this area. But, yeah. So I'll keep you guys posted. I'll do updates, as far as the scarring, and especially when I get the thighs and stuff done. I do have a video that I'm going to try to get on there. It actually shows me beforehand all my excess skin. I literally was in panties and a bra with a towel wrapped around me, and I flashed everybody and did this whole video. To kind of give you guys, more of the whole deal. I'm shy, but I'm not shy. When I'm in front of a video camera, it's different than when there's actually an audience that I'm looking at, so I can do a lot better on video than I can do in person. So that's it, and everybody have a great day, and I will try to keep up on my videos, okay?